So these right here are whipworms. They're a soil-transmitted helminth and an intestinal parasite. They're found in the large intestine and are the third most common roundworm in humans. The size of these worms can be between 3 centimeters and 5 centimeters, and the name comes from the whip-like shape because, as you can see, the tail end is much thicker because the reproductive organs are there, making it look like a whip handle, and then the top of the head is like very skinny, making it look like the whip. Because they're in the intestine, they can cause intestinal disease, and they are spread through the feces of an infected person or animal. The female whipworm can lay anywhere between 2,000 and 10,000 eggs per day, and these eggs are deposited in soil from feces. Infection is more prevalent in places where access to hygiene and sanitation practices are limited, which is typically in tropical climates. People with mild infection don't have symptoms, so it's possible for people to just walk around with worms not knowing that they have them. People with severe cases have frequent and painful bowel movements that are a mixture of mucus, water, and blood, and are at risk for rectal prolapse. Children can experience impaired cognitive development and slowed growth as a result of severe infection. Whipworms are diagnosed by looking at a stool sample under the microscope, and they can be treated by medication for 1 to 3 days. It's estimated that worldwide there are between 450 million to 1 billion active whipworm cases in humans. And in 2002, the estimated number of people with whipworms was 1 billion. To put this into perspective, 1 in every 6 people on the planet in 2002 were just walking around with worms.
Introducing an easily transmissible, highly irritable, and the most common worm infection in the United States, pinworms. Pinworms are small parasites that affect humans and live in the colon and rectum. They make their way into one's body when one swallows its eggs. These eggs hatch in the intestine, and while one is sleeping, the female pinworm will leave through the anus and lay more eggs on nearby skin. Thus, if an infected person touches their anal area, the pinworm infection can easily spread. Moreover, pinworm infections are very common, affecting approximately 1 billion people worldwide. Did you know that experts estimate that 1 in 10 people throughout the world become infected with pinworms? People of all ages can become infected with pinworms, but the infections are found most often in children. Many people don't have any symptoms at all, but others feel itchy in the anal or vaginal area. Therefore, most people with a pinworm infection may not know they have it at all. A common way to collect the eggs is by placing a sticky piece of clear tape by the anal area. Mild infections don't really need treatment, but to prevent being infected by pinworms altogether, it is important to change your underwear daily, avoid scratching the anal area, avoid biting your nails, and washing your hands.
Hi, the worm I chose to do is called a loa loa, also known as an eyeworm. The loa loa actually means worm in African language that it was first originated from, but it's more commonly known as the eyeworm. The loa loa is usually passed on to humans by repeated bites by the deerfly, and this worm moves from the eye to the body and back and forth in this manner. To describe the loa loa, as it'll appear here, it has a cylindrical shape. It has a cuticle with 3 main outer layers made up of collagen and other compounds. These outer layers are secreted by the epidermis, which is the outermost layer of the skin. This worm does affect humans, but it's extremely rare to see in the US. It's most prevalent in places in West Africa and Central Africa. Though there are no prevalent statistics for the US, since it's so rare here, there are many for West Africa and Central Africa, with the high infection rates of over 14.4 million affected. As it's seen in its common name, this worm, the loa loa, affects the eye, and to do this, it crawls onto the surface of the eye and moves within the eye cavity and into the body. One of the most common symptoms of the loa loa infection includes rhythmic itching in the eye. This is classified as Calabar swellings. The other symptoms include muscle aches and joint pain. With prolonged infection, the loa loa may cause blindness, but it's extremely rare. It's usually easy for people to tell if the worm is in their body because they usually have some sort of infection or itchiness in their eye, and they can usually tell if something is moving within it, sort of like if you feel a bug moving in your eye. There are some cures and some treatments There's not too much to do about the infection. There are new studies and new treatments being developed for it. But to remove the actual worm, it's pretty easy for the provider or the doctor to remove it from the surface of the eye while it's there. In conclusion, if you live in the US, the risk for loasis is very low. Even if you live or visit any areas of risk, your risk of infection would depend on the number of bites you received from a deer fly, the number of infected deer flies in the area you're living in or visiting, and the length of the stay of your stay in the area of infection.
Hi everyone, my name is Varsha and I'm going to be talking about flatworms. So flatworms, also known by their scientific name, Helminths, comprise a diverse group of different worms. And while the majority of flatworms don't actually infect humans, there are exceptions, such as the blood fluke schistosoma. Schistosoma parasites cause schistosomiasis, which is a disease that affects millions of people worldwide, actually. And these parasites primarily will target the blood vessels of urinary or intestinal systems and enter the body through skin upon skin contact with contaminated freshwater sources. So schistosomiasis is particularly prevalent in tropical regions and subtropical regions. So think Africa, South America, the Caribbean, or Southeast Asia. And in early stages, infected individuals might not really exhibit any symptoms or any issues, which leads to potential unawareness that they're even infected in the first place. However, if it's left untreated, chronic infections can lead to a lot of severe health problems. Some examples of that include liver fibrosis, bladder and kidney damage, gastrointestinal bleeding, and overall just a weakened immune system that would increase your susceptibility to other infections. Therefore, early detection and treatment are very important to prevent the progression of schistosomiasis and mitigate its potential long-term health consequences.
Thorny-headed worms are helminths that have spines to pierce and hold the gut wall of their hosts. They mostly infect wildlife and domestic animal species, but they rarely infect humans. If they do infect humans, then it mostly affects the intestine. Thorny-headed worms are pretty prevalent, with an estimated 1,100 species being described within its phylum, and the phylum is called Acanthocephalum. Again, very few cases have been reported, so the question of whether people that might have been affected but not know about it doesn't apply too much to this particular scenario. Worms range from 4 to 32 centimeters based on the subspecies. Females tend to be longer than males in this phylum, and pigs in southern states are commonly infected, along with other farm animals. Lesions and ulcers are common effective infections for many animal species, both wildlife and domestic. Diagnosis can be made through necropsy by finding and identifying the parasites. Infections can also be found through laboratory fecal examinations. This is possible for both animals and humans. Symptoms for humans, although human infections are rare, include giddiness, acute abdominal pain, tinnitus, edema, constipation, diarrhea, undernutrition, and underdevelopment. So, although thorny-headed worms may not be too scary for us humans, they're pretty scary to our own dogs and cats, and to the farm animals who live out on the countryside.
This is basically a diagram of a example of a thorny-headed worm. So here we can see the body wall, we can see the body cavity, we can see the retractor muscles, we can see the testes, etc.
So, thorny-headed worms, not really that known about. Not a lot of extensive research has been done about them. However, it's very cool and interesting to know about a worm that has a bunch of thorns on it. So, and we have to make sure that we know more about them so that, wildlife and animals and farm animals more specifically can be kept safe. Maybe even for our own safety, because there are a few infections going on. And that's it.
Hi everyone, my name is Rivi, and today I will introduce you to the world of hookworms. So to start, we'll talk about how the name hookworms actually came about. So hookworms are named after their hook-like mouth part that they use to anchor themselves to the lining of intestinal walls of the human body. So here are a few pictures of general parasitic worms, and once again for today we'll be focusing in on the hookworm. So this is what the hookworm looks like, and here are a few physical characteristics that separate them from other parasitic worms. So generally hookworms are pinkish and white, they're 8 to 13 millimeters long based on if they're female or male, and they have needle-like spicules that allow it to latch onto the intestines, as said before. So in terms of prevalence, hookworms are most prevalent in warm, humid climates where there's poor hygiene and human feces are used as fertilizer. So contaminated soil is when you have an infected individual defecate in the soil and their feces are in the soil. So the eggs of hookworms transport in the human feces and then they hatch and mature, which then allows them to penetrate the human skin. So once again, the primary cause is if an individual walks barefoot in contaminated soil, which I mentioned before, is when an infected individual's feces are in the soil. So the first signs of a hookworm infection is itching or a localized rash due to the penetration of the human skin. Later on, if that infection does develop into a heavy infection, you may experience abdominal pain, diarrhea, weight loss, and the most severe side effect is anemia, which is due to blood loss. So the diagnosis of a hookworm infection is mainly through finding eggs in an individual's stool sample, which is done by a physician. And most people infected with hookworms actually don't exhibit any symptoms, so they don't even know it's occurring, which is what makes it so dangerous. But if it does develop into a heavier infection, they can have the following symptoms as I listed before. And the main treatment for hookworms is just using any kind of antiparasitic medication that is prescribed by your.
Hello, my name is Jordan Nazi, and today I'm going to be talking about tapeworms. To begin, tapeworms refer to the classification of parasites that can host in the intestines of humans. Although this worm usually resides in one's intestines, tapeworms can also reside in one's brain, liver, lungs, heart, or eyes in more serious cases. Tapeworm infections are considered rare, meaning that there are fewer than 200,000 cases annually in the United States. Given that not many individuals have tapeworm infections, the chance for an individual to not be aware that they are a host for this parasite decrease. However, the chance is not zero. And here is an example of a tapeworm. In terms of symptoms, causes, and risk factors, the common symptoms of a tapeworm infection include stomach pain, loss in appetite, loose stool, diarrhea, weight loss, and cravings for salty food. In terms of the causes of a tapeworm infection, humans may get a tapeworm infection by consuming raw and/or uncooked beef, pork, or fish. Regarding risk factors, a tapeworm infection becomes more likely by engaging in factors such as eating raw and/or undercooked meat, practicing poor hygiene, and having a lack of clean water, and finally having a lack of sanitation and sewage. Thank you.
My worm of choice was the liver fluke, and what I found was that the liver fluke worms can indeed infect humans. The most common species that infect humans are Fasciola hepatissa and Fasciola gigantissa. These parasites primarily affect the liver, hence their name, the liver fluke. When a person becomes infected, the liver fluke eggs are typically consumed through contaminated water, vegetation, or undercooked aquatic animals, such as fish. Once ingested, the eggs hatch in the intestine and the larvae migrate through the abdominal cavity to reach the liver. In the liver, the flukes mature, reproduce, and can cause various health problems. The prevalence of liver fluke infection varies geographically. It is more common in certain regions of Asia, Africa, Europe, and South America, where agricultural practices and dietary habits increase the risk of exposure to the parasite. In these areas, the infection is often associated with the consumption of raw or undercooked fish. As for people not knowing they have a liver fluke infection, it is possible for individuals to be asymptomatic or exhibit mild symptoms, especially during the early stages of the infection. In such cases, the infection may go unnoticed or be mistaken for other conditions. However, as the infection progresses, symptoms can become more pronounced and include abdominal pain, nausea, vomiting, fever, jaundice. In chronic or long-standing infections, it can lead to complications like liver fibrosis, bile duct obstruction, or a type of liver cancer.